The flow of air into and out of the lungs can be measured as a series of volumes. Any two or more of these volumes added to each other represents what's called a respiratory capacity. Volumes and capacities can be analyzed to track certain diseases. The first volume we need to know is our tidal volume. This is the amount of air that's inhaled and exhaled with normal, quiet kind of breathing over the course of a minute. It's about 500 milliliters. The next volume is our inspiratory reserve volume. This is the amount of air that you could breathe in following a normal tidal breath in. So if you could allow yourself to take a normal breath in and immediately follow that by forcing yourself to breathe in again, that's your inspiratory reserve volume. And you have an expiratory reserve volume as well. That is the additional air you could force out following a normal, quiet breath out. So if you allow yourself to breathe out, then force yourself to take another breath out, that's your expiratory reserve volume. Even when you try to force all of that air out of your lungs, some air will remain in the alveoli. This is called your residual volume. We need this residual volume because it's what lets our lungs exhale without collapsing. Without this residual volume, the two sides of the alveoli would touch and the lungs would collapse. Any two or more of these volumes added to each other represents a respiratory capacity. Like, if we add tidal volume and inspiratory reserve volume, we get the inspiratory capacity. Think about this as the biggest single breath in that you could possibly take. Allow yourself to exhale, and then immediately take your biggest breath in. That's your inspiratory capacity. Our functional residual capacity is the combination of expiratory reserve volume and residual volume. Our vital capacity is the amount of air that we could move in a single breath. Your biggest breath in followed by your largest breath out. And your total lung capacity is all of the volumes added together. All of your inspiratory, tidal, expiratory, and residual volumes together represents total lung capacity. Not all of the air inspired into the respiratory system can get exchanged with the blood. Only the air that makes it into the alveoli can be exchanged. Air in the conducting zone structures, your nose, your pharynx, your larynx, your trachea, the bronchial tree, are in conducting zone structures and cannot be exchanged with the blood. This area where exchange does not happen is referred to as the anatomical dead space. The average dead space is about 150 milliliters. So if tidal volume is 500 and our dead space is 150, only about 350 milliliters reaches the exchange space. This dead space is increased while you're snorkeling and you have this additional tube sticking out of your respiratory system, which is why you may notice that you have to take longer, larger breaths in order to feel like you're breathing normally while snorkeling. We can measure respiratory volumes and capacities using a device called a spirometer. This spirometer is useful because it allows us to evaluate the loss of respiratory function and it allows us to track certain kinds of diseases. We can use these tests to distinguish between those disorders and diseases that are obstructive and or restrictive diseases. Obstructive diseases involve an increase in airway resistance, like asthma. It winds up making it very hard to inhale and to exhale because there is an increase in resistance in the airway. Restrictive diseases affect lung capacities, like tuberculosis, making the lungs much less compliant, affects their capacity to expand and would reduce total lung capacity. We can obtain more information by assessing the rate of airflow into and out of the lungs.